The purpose of this presentation is to shed light on a pressing issue that affects the lives and well-being of countless individuals. This is the discrimination against LGBTQ individuals within the healthcare settings. Discrimination in healthcare creates a significant obstacle for people to get the vital medical help they need. Often, the discrimination is based on bias and prejudice. The fear of judgment, stigmatization, and mistreatment can create a hostile environment that leaves LGBTQ individuals reluctant to engage with healthcare providers. The repercussions of such discrimination extend far beyond reluctance. They can have life-threatening consequences, as LGBTQ individuals may be turned away from healthcare settings and encounter difficulties in seeking alternative services, leading to detrimental delays or outright denials of medically necessary care. In this presentation, I share a few real-life stories that highlight the gravity of this issue. In New Jersey, a man filed a lawsuit against Trinitas Regional Medical Center, alleging improper medical treatment due to his sexual orientation and HIV-positive status. This incident underscores the pressing need to reform in healthcare practices and the importance of ensuring that all patients, irrespective of their minority group, status, or sexual orientations, are entitled to competent and comprehensive medical care. Furthermore, in 2016, a troubling incident occurred in Rady Children's Hospital in California. A transgender child named Kyler, who was struggling with gender dysphoria, was subject to repeated misgendering and lack of support within the hospital, which exacerbated his distress. The incident tragically ended with Kyler taking his own life. His mother, Catherine Prescott's subsequent lawsuit against the hospital is a call for accountability to prevent similar instances of discrimination in the future. However, the discrimination against LGBTQ individuals does not end in traditional healthcare settings. It extends to behavioral health settings as well. These individuals encounter biases, stigmatization, and insensitivity from healthcare providers and staff, paralleling the challenges that they face in broader society. To ensure that all LGBTQ individuals receive equitable and exclusive behavioral health care, comprehensive measures are required, including cultural competence training, creating stigma-free environments, ensuring that physical accessibilities and necessary accommodations are met. But it's not just LGBTQ individuals who face discrimination within healthcare. Individuals with disabilities still encounter significant disparities. In accessing care, despite the American with Disabilities Act, the ADA, which was enacted 30 years ago to prohibit discrimination in healthcare based on disability, discrimination in healthcare against people with disabilities is a complex issue still rooted in factors like healthcare providers lacking the skills, time constraints, and biases related to the quality of life and preserving worthiness. To highlight this issue, this presentation shares two stories. One was first during the COVID-19 pandemic when a woman with an intellectual disability in Oregon was denied the ventilator due to her low quality of life. Disability rights advocates stepped in to save her life, but this incident emphasized the need to address healthcare disparities during a public health crisis, particularly for individuals with disabilities. Second is the case of Michael Hickson in Austin, Texas, who was denied essential medical treatment based on his quadriplegic disability. Despite having multiple serious health issues, including a urinary tract infection, he had sepsis, pneumonia, and he also had suspected COVID-19, Mr. Hickson was denied treatment. This raises serious question about medical discrimination. Mr. Hicks's death underscores the ongoing debate surrounding healthcare disparities, patients' rights, and the importance of upholding ethical standards in the medical decision-making, regardless of an individual's disability or health condition. It is crucial that we address the issues comprehensively, and discrimination in healthcare can have dire consequences for individuals' health and well-being. It's time to create inclusive and accepting healthcare environments by implementing policies, training, and cultural shifts within the healthcare system. By recognizing and rectifying these disparities, we can ensure that all individuals, regardless of their sexual orientation, gender identity, or disability, can have equal access to the quality healthcare services. It is our moral obligation to protect the right and dignity of every patient, regardless of their background or their identity.